four out of 10 women in their lifetime will be affected by pelvic organ prolapse. That means something is falling out of the vagina. So it's very common. But does that mean that every prolapse needs to be corrected? In other words, can I just ignore it? Can I do nothing about it? Well, some cases it would be dangerous. I have seen patients who have a massive pelvic organ prolapse, so larger than a lemon, much larger, sometimes like a grapefruit, and sometimes even larger than that. Larger than a grapefruit. I am not kidding. That is sometimes we see. It's what I see in our practice. And you're wondering, why are they waiting so long? I think they are afraid that something, they're afraid of undergoing a surgical procedure, and they're sort of used to this thing slowly and gradually getting bigger and bigger. It's not overnight, but it's over time it gets bigger and bigger. But there could be problems. You cannot ignore that. You cannot ignore prolapse. You at least have to come and see a doctor like me, a specialist like a urogynecologist. Why? Because you want to make sure that it's not impacting your organs. In the front, it could impact your bladder. Your bladder may not empty and it causes retention. That can cause a problem because you can get frequent bladder infections. Second, the tubes that come from the kidneys down, they can get kinked and can damage the kidneys with a large prolapse. Or it can also affect the vaginal walls. They can get ulcerated and they can break down. So there could be a lot of problems that can happen with prolapse. And one thing you want to do is absolutely get it assessed. That doesn't mean that you have to jump to surgery or the surgeon like me is going to jump to surgery. No, we will counsel you correctly as to your options and then you can decide. But at the least, you want to make sure that it is looked at. So if you see a bulge at the opening or something is not right, make sure you come to a urogynecologist and let us check it out because we'll do a comprehensive assessment and then come up with a proper decision plan with you.